I've heard that you can't get pregnant if you have sex during your period.
I don't worry about it. I mean, I always pull out before anything happens.
Well, I don't do it that often, only every now and then, so I don't really have to worry about getting pregnant.
I don't really worry about my girl getting pregnant. It's her responsibility to use birth control, not mine.
Even though these statements are not true, many people believe them. And they think it just can't happen to them until it does. Unless you say no, like many people do, having sex without birth control is like making a choice to get pregnant. And it can happen the very first time. So unless you really do want to get pregnant, use birth control.
In this program, we will look at how the reproductive system works, what happens during intercourse, and how different types of birth control can lower the chance of a woman getting pregnant. Let's start by looking at what happens inside a guy during sex. Sperm are made in the testicles, which are packed with tubes that make millions of sperm. The sperm travel up this long tube that leads to the penis. A group of glands here make fluids that mix with the sperm to make semen. When a guy gets sexually excited, some of the fluid, which contains sperm, comes out before he ejaculates. This is why withdrawal before ejaculation isn't safe. Even touching the penis to an outside of a girl's vagina can be enough to get her pregnant. So this means even if you're just messing around and not going all the way, you should use protection.
It only takes one sperm to get a woman pregnant, and a man puts out millions of sperm every time he ejaculates. It's hard to imagine how one of these doesn't get to the egg. Looking at a woman's body when she's lying down, this is the position of her reproductive organs. This is the vagina, where the penis enters during sexual intercourse. When a man comes, he deposits the sperm into the vagina. The sperm go on their way, swimming through the cervix and uterus and into the fallopian tubes towards the ovary. If the sperm meet an egg in the tube, the woman is likely to get pregnant. Even if there is not an egg in the tube at the time of sexual intercourse, the sperm can stay alive and wait around in the tube for up to 5 days. This means that you can have sex on Monday and get pregnant on Friday. If you really understand the cycle, you see why you can have sex and sometimes not get pregnant, and other times you're very likely to, unless you use some kind of birth control. Before we talk about the other methods, let's talk about emergency contraception, also called EC. It's a well-kept secret. Emergency contraception works really well in certain situations, like when a condom breaks or you forget to use birth control and you're worried about getting pregnant. It's most effective if it's used as soon as possible after unprotected sex. Everyone using birth control should have emergency contraception on hand, just in case it's needed. If you don't have it, whether you need it right now or not, ask your doctor for a prescription. You don't need to have a physical exam to get EC.
Last night, my boyfriend and I were having sex, and the condom broke. I'm so worried. I don't want to get pregnant.
Well, there's something else you can do to reduce your risk of pregnancy. It's called emergency contraception. It works best if you take it as soon as possible after having unprotected sex.
I'll try anything at this point to keep from getting pregnant. I'm just not ready.
Okay. Here's the emergency contraception. I've got some water so you can take it right now. I'm also going to give you another packet of emergency contraception for you to have if your condom breaks again. Every woman, no matter what method of birth control she uses, should have emergency contraception on hand just in case she needs it.
I feel better about this already. You know, I don't have sex very often, and when I do, I think I'd like to use emergency contraception all the time instead of using condoms.
That's not a good idea. First of all, emergency contraception, when used by itself, is not as effective as other methods at preventing pregnancy. You should continue to use condoms or choose another method to use all the time. Like the name says, emergency contraception should only be used for emergencies.
There are 5 types of birth control you can use all the time. Monthly hormonal methods, progesterone-only methods, intrauterine contraception, barrier methods, and sterilization. A 6th option, emergency contraception, is used just for emergencies. Some types of birth control you can just walk in and buy yourself, like at a drugstore. and others you can get at a clinic or through a doctor.
If you're healthy, you don't need to have a physical exam to start birth control. Monthly hormonal contraceptives contain two hormones, estrogen and progestin. The hormones are similar to those made by your own body. When used as directed, these methods are safe and very effective at preventing pregnancy. You can choose from pills, vaginal rings, skin patches, or shots. They all contain the same two hormones. It all depends on what you think is right for you.
Millions of women use monthly hormonal methods of birth control every day and are very happy using them. Let me take a look at your chart. According to the doctor's notes, there's no reason why you can't use a hormonal method. Let's talk about monthly hormonal methods first. This group includes pills, rings, patches, and shots. They all provide hormones, but they deliver them to the body in different ways.
Okay, so is it safe to use hormones for birth control? I heard they could cause cancer.
Hormonal methods are safe and very effective when used as directed. And no, birth control containing hormones does not cause cancer. In fact, monthly hormonal birth control pills help prevent cancer of the uterus and ovary. So let's start with the pill. Would it be hard for you to remember to take a pill every day at the same time?
No, I'm a pretty organized person.
That's good. It's very important to remember to take the pill at the same time every day because you're maintaining a certain hormone level in your body that keeps it from releasing eggs. That keeps you from getting pregnant.
So, what happens if I miss a day?
Well, it's not a good idea, but it's not the end of the world. If you miss a day, you need to take the missed pill as soon as you remember. If you miss more than one pill, there are ways to catch up. I'll give you some written instructions on missed pills as well as information about emergency contraception and a packet of EC pills that you can take with you.
Okay.
When you use pills on a monthly basis, you start with this one here and you take one pill every day at the same time. While you're taking the last 7 pills that are a different color, you'll get your period. Then you start on a new pack of pills.
Okay, that sounds easy enough.
There are many different types of birth control pills. Even though they look the same, they contain different hormone levels for different bodies. That's why you should never borrow a pill from a friend.
That makes sense.
Now let's talk about the other types of monthly methods. They work pretty much the same way, but they are not pills that you swallow.
Okay.
Instead, they deliver hormones into your body through the walls of the vagina, through the skin, or by injection.
You mean like a shot?
Yes. One type of monthly hormonal method is given through a shot. Injections are given once a month, so the only thing you need to remember is to return for your next shot.
Oh, I don't think I want shots once a month.
Well, then you might like the vaginal ring. You place the ring in the vagina for 21 days, and then you remove it for 7 days. During those 7 days, you'll get your period. The next cycle begins with the insertion of a new ring. It's pretty convenient because you don't have to remember to take a pill every day, and no one can tell that you're using it. There's also the patch. Patches are applied to the skin, and each patch remains for 7 days. You wear the patch for 3 weeks in a row, followed by 7 days without the patch. You wear the patch on your abdomen, upper body, or buttocks. It is visible, but you can always cover it up with clothing.
Wow, I didn't know I had all these choices. They all sound pretty convenient. Will any of these methods make me feel different?
When you first start any of these methods, you may notice some changes. Most of them are mild and will go away during the first 3 months. Getting used to hormones is like breaking in a new pair of jeans. It takes a while. If you develop a headache, shortness of breath, or pain in your arms and legs, or if you have any questions about anything, you should call us right away. Also, these methods do not protect you from sexually transmitted infections like chlamydia or HIV, so you still need to use a condom.
Okay. I have another question. A lot of people say you gain weight when you use hormones.
That can happen. Some women gain weight and some lose weight. Watching what and how much you eat and exercising regularly will help prevent weight gain. But if you have any problems, please call us before you stop using your birth control method.
Okay. Well, let me think about these 4 options. Thank you very much. You've been very helpful.
There is a type of birth control that contains only one hormone. It's called progestin. It is similar to the natural hormone made by the ovary.
There are 3 progestin-only methods: pills, implants, and injections. When you use the pills, you take one every day, just as you do with the pills that contain 2 hormones. Progestin-only pills, though, are not as effective as other birth control pills. Contraceptive implants work a little differently, and they are effective and hassle-free. This method is good for 3 to 5 years, and once the implants are removed, most women can get pregnant right away. Would you like to hear more?
Sure.
Okay, let me show you what they look like. They're about the size of matchsticks, see? And they're inserted under the skin in your upper inner arm. Let me show you. Here's where they go. The whole procedure takes about 10 minutes in a doctor's office. Your healthcare provider will give you a local anesthetic, so there's very little pain. A small opening is made in the skin, and the implants are inserted just under the skin. There may be bruising and tenderness, but only for a few days. You don't even need stitches.
Do they leave a bump on your arm?
You may be able to notice a bump from the implants in some women, but they don't hurt, and you hardly even know they're there. All the time, though, they're slowly releasing progestin, which prevents pregnancy.
Will I notice any changes in my body?
Well, you may have irregular spotting or bleeding, but this goes away after you've used this method for a while. Do you think you might be interested?
I think so, but if I have any problems, the implants can be easily removed, right?
Yes. Now, there is another form of progestin-only contraception that doesn't require removal. It's given by injection.
I never heard of shots for birth control.
Well, you get an injection once every 3 months. Like implants in the pill, the hormone in the injection makes the mucus in the cervix thick, so sperm can't reach the egg, and it prevents ovulation. No sperm, no egg, no pregnancy.
Well, I suppose there are pros and cons.
Well, some women may gain weight, and it is common for women to stop having their periods if they've used this method for a while. On the other hand, you only have to think about birth control once every 3 months.
I think these might be real possibilities for me. Can I think about it for a couple days and call you?
Sure. Let me get you some written information and condoms to take with you.
Thanks. I'll talk to you soon.
We've talked about emergency contraception, monthly hormonal contraception, and progestin-only methods. The next birth control method we're going to look at is the IUC, which stands for intrauterine contraceptive or contraception.
You know, with my kids and my job, it's going to be really hard for me to remember to take a pill every day or to remember to change a patch once a week. I think I'm looking for a method of birth control that's going to be more convenient for me.
Well, let me show you an IUC. This is what it looks like. The arms of the device fold, and a clinician inserts it through the cervix and into the uterus like this. The arms unfold and the device is in place. Once it's inserted, there's nothing to worry about on a daily or weekly basis, and it's very effective at preventing pregnancy.
I don't get it. How's this going to keep me from getting pregnant?
Well, there are 2 kinds of intrauterine contraception, hormonal and copper. The hormonal IUC releases progestin, one of the same hormones used in birth control pills. In addition to killing the sperm, the hormone makes the mucus in the cervix thick so that sperm can't get to the uterus. The copper IUC kills the sperm before they can reach the egg, and it can prevent pregnancy for 10 years.
What's the string for?
The string allows you to make sure the device is in place. Most women check it after they have a period and before they have sex.
You mean it's likely to fall out?
Very rarely, almost never.
Well, I suppose there are disadvantages to it like there is with everything else.
Yes. Some women who use the copper IUC may have heavier or more painful periods, and women who use the hormonal IUC may stop having periods.
Is a serious infection likely?
No. IUC does not cause infections. But if a woman using this method gets an infection in her fallopian tubes, it could become more severe. Women who have sex with more than one partner or who are at risk for sexually transmitted infections should consider using another method of birth control.
You know, I think this might work for me.
Barrier methods are another type of birth control. These work by blocking the sperm so they can't reach the egg. Condoms for men have been around for a long time. Obviously, you don't need a prescription for these. Your local drugstore has many for you to choose from. One thing to remember, make sure you buy latex or polyurethane. The sheepskin kind don't protect you against infections. When I was younger, I remember a lot of guys were nervous just walking in and buying condoms because they're embarrassed. That's ridiculous. Many men and women buy condoms every day.
Thank you.
See how easy that was? They got different types of contraceptives for women, but there's only one kind for men. So sooner or later, you should learn how to use one of these properly. See, it rolls on like this. It's easy. Most condoms have a tip here to make room for the semen. If it doesn't, then make room by pulling on the condom like this. This is very important. If there's no room when you have sex, the force of semen may break the condom or force the semen to leak. After sex, and before you get soft, pull the condom tight down here. That way you won't lose any semen while pulling out. And remember, do not use petroleum jelly or other oil-based lubricants with condoms, or carry them in your pocket or wallet for a long time, because they may not protect you. There are plenty of guys who decide they're not going to have sex until they're ready to accept the responsibility of having a child. But for those who engage in sex, a condom is the only method a man can use to keep from becoming a father before he wants to. A condom is the only thing to protect you from sexually transmitted infections, like HIV. So even if your partner's using a different method, if you have sex, use a condom. It's inexpensive, it's easy, and it works.
When you use a condom, you should use spermicide. Spermicides kill sperm. There are several different kinds to choose from. They come in foams, gels, films, and suppositories, and you can buy them without a prescription. Make sure to look for the word contraceptive. Be sure you're buying the right thing. And remember, douches and feminine deodorants are not contraceptives and will not kill sperm.
Sex can be complicated, huh? Even when Eddie uses a condom, I still get nervous.
Well, you could use your own method of birth control, like pills or spermicide, to decrease your chances of getting pregnant.
But I don't understand all the different spermicides. I mean, how do you know which one to use?
Well, personally, I use foam. See, my partner and I, we trust each other to use birth control. So when we have sex, he uses a condom and I use foam. We feel confident that by using the two methods together, I won't get pregnant. And then we don't worry about sexually transmitted infections either.
But doesn't it make you feel itchy afterwards?
You know, the best thing about spermicide is I have no side effects at all. I mean, they say you might have some irritation, but I haven't experienced any. I usually use foam, but sometimes I use suppositories or film because they're so easy to carry around with me. I can even put it in my purse.
Foam and gel work best when inserted deep inside the vagina just before intercourse. Some products take 2 applicators full, so remember to read the directions. Also, remember to add more before any additional intercourse, or if more than 30 minutes goes by. Suppositories and film work just like foam or gel. Suppositories are small pellets, and film looks like a very thin piece of paper. Each dissolves after being inserted in the vagina, back near the cervix. Again, you need to read the directions to see how long to allow them to melt. Use 1 suppository or a piece of film before each time you have intercourse. And remember, no matter which spermicide you use, you must leave it in for 6 to 8 hours after sex to kill the sperm. Also, remember that spermicides do not protect you from sexually transmitted infections or HIV. Now, a man has only one barrier option, a condom, but there are several barrier methods that a woman can use: a diaphragm, a cervical cap, or what's called a female condom. All 3 methods are safe and effective when used correctly.
My partner doesn't like to wear condoms, but I really want to protect myself from getting pregnant.
Okay. Well, let me show you the barrier methods for women. In a way, these methods work for a woman the way a condom works for a man. The diaphragm and cervical cap cover the cervix, the opening to the uterus, to keep the sperm from reaching the egg. Plus, they hold spermicide to kill sperm. A female condom forms a barrier to keep the sperm from getting into the vagina. If you choose to use a diaphragm or the cap, you need to see a clinician or doctor to make sure it fits right. Now, the thing to remember is that these methods work together with the spermicide. Let me show you how to use a diaphragm. Put the spermicide all the way around the edge, and then a little in the middle. And then you spread it around.
That looks kind of gooey.
But remember, without the spermicide, these methods don't work as well. Let me show you how to put them in the model. To insert the diaphragm, you squeeze it together like this and push it back until you feel it go over the cervix. The cervical cap must be placed on the cervix, and it is held in place by suction. Let me see your arm. Feel suction?
That's kind of cool.
Yeah. The real advantage of the cap is that you can leave it in a full 48 hours, and you don't have to add more spermicide if you have sex again. Now with the diaphragm, you have to put more spermicide in your vagina each time you have sex, and you can't leave it in longer than 24 hours. No matter which of these you choose, you have to leave it in for at least 6 to 8 hours after you have sex.
Can the cap or the diaphragm get knocked out of place during sex?
It's possible, but if it is inserted correctly, it doesn't happen very often. And the first few times, until you're sure of yourself, you should check it before and after having sex.
So what if you find it's not in the right place after you have sex?
Then you put more spermicide in your vagina and leave it for 6 to 8 hours. You might want to use emergency contraception too.
Will my partner feel anything?
If it is placed properly, neither you nor he should feel either method.
Okay. So which one is the easiest?
Well, that's really up to you. We're going to let you practice so you can see which one you like better. But ultimately, it's an individual's decision.
I'm not sure. What about the female condom? I like the idea that I can protect myself from pregnancy and infections, even if my partner doesn't like to wear condoms.
Here, let me show it to you. Like you said, a great benefit of the female condom is that it not only can protect you from getting pregnant, but it can also protect against sexually transmitted infections. Just as you do with the other barrier methods, you need to practice inserting it. You hold this open ring with one hand and the second ring with the other hand. Then you insert it so it fits over the cervix. You take the open part and hold it until it covers you. It's lubricated, so it makes things pretty easy. So, what do you think?
Well, I'll try each of them and I'll see how it goes.
The last category of birth control is much different from the ones we've seen so far. It includes permanent methods that require surgical procedures. These methods are for people who no longer want to have children. For a man, this is called a vasectomy. The tube that carries the sperm from the testicle into the penis is cut and closed. That way, no sperm are released when he ejaculates. But other than that, there is no effect on the man.
For a woman, the fallopian tube, which carries the egg from the ovary into the uterus, is closed here. That way, the egg and the sperm can't meet, so pregnancy is not possible. Now, anyone who is considering these procedures should think about them seriously, because they are essentially irreversible.
You know, George, I don't understand why people would have sex without protecting themselves. I mean, there are birth control options for both men and women.
You know how it is. I mean, things can get pretty heavy sometimes, and plus, I figure it's the girl's responsibility anyway.
You ever ask a girl about that?
Not really.
Well, I don't think it's only a girl's responsibility. I mean, she can't get pregnant all by herself. Plus, what about infections? I'd rather wear a condom than risk pregnancy and an infection. You know, millions of people have sexually transmitted infections, including HIV, the virus that causes AIDS.
Really? Millions?
Yeah.